What is the difference between IVF clinic and a fertility clinic? Explain.
An IVF clinic would do only IVF, and most IVF clinics don't do only IVF.
What is IVF?
In vitro fertilization. For any couple, there are three main ways they can get pregnant. One is trying naturally, planned relations. Then you have a simpler treatment option called an IUI, an intrauterine insemination. And then you have IVF. Now, when we do an IVF, what do? Here we had that crop of eggs that came to the surface that would have been thrown away by the body. From the first or the second day of the cycle, for 10 days, we do what is called ovarian stimulation. So we give these gonadotropin injections. Now what we use are subcutaneous needles, the very thin needles, which is such a tiny prick, most women barely feel it. And what is coming up now is needle-free. Without even the need of a needle, the gonadotropin can be administered.
So injections at the start of the cycle.
From the first day for about 10 days.
10 days.
These are given to save that crop that the body would have discarded. So let's not let it get discarded. Without stimulation, one egg would have grown. With stimulation, that whole crop will grow.
How many?
How many ever the antral follicle count is. If it is 4, we expect 4 will grow. If it is 10, we expect 10 will grow.
Okay.
Why we need all of them to grow? Why not just pick up the one that is naturally forming? Because every egg is not going to become an embryo, and every embryo is not going to become a baby. Out of that crop, we don't know which one will. So this is the crop that was recruited for this month. It is stimulated. When they are ready, in 10 or 11 days, they have reached a ready size. 2 days later, the egg retrieval is planned, which I already described,
Yes.
5 or 10 minute procedure. Now we have aspirated these eggs, so they don't need to release inside the body. The fallopian tube doesn't need to pick them up anymore. We have aspirated them, and under the microscope, we actually inject each egg with each sperm to make it fertilize.
So you take sperm separately.
Yeah, the sperm is taken, it's an ejaculated sample in most cases, and then you actually join the egg and sperm. The embryo that forms is directly placed into the uterus. So now there is only that last step left for nature to do.
To implant.
To implant. But now we have helped nature at almost all the different steps except for implantation that nature has to do. Of course, everything required to increase the chances of implantation, the support is given to make sure that we have...
And which embryo will you implant? There will be multiple embryos will be formed.
It's not always that we get multiple embryos, but sometimes we do. So this is a very...
So when a sperm is inserted into the egg, doesn't mean that embryo will be formed.
Not always. Not every egg. Remember we spoke about a lot of eggs having chromosomal defects and some of them don't become embryos. Yeah. But now, yes, we are culturing our embryos up to the blastocyst stage. So what happens is that earlier, some years back, and maybe at some clinics even now if they don't have the facility, embryos were being transferred on day 2 or day 3 after fertilization. Most of the eggs that will fertilize will reach up to that stage, but nature has a filter in place where every embryo after that will not become a blastocyst.
So what is a blastocyst?
A blastocyst is the stage it reaches at day 5 or day 6. It's multicellular. You start with one egg. The next day you check how many have successfully fertilized. By day 2 it starts dividing into 2 cells, 4 cells. By day 3 we expect it is 8 cells. By day 5 or day 6 it is a blastocyst. It has an outer layer called a trophectoderm, which is going to become the placenta. It has an inner cell mass which is going to become the baby, and it has a cavity which is filled with fluid. So this is a blastocyst. Because every egg will not reach till there, waiting up to the blastocyst stage before you transfer already gives you an excellent natural filter. So the ones that did not grow up to blastocyst stage, if you would have transferred on day 2 or day 3, you have no way of knowing which 1 or 2 or 3 are going to go ahead. So supposing you have 8 of them on day 2 or day 3, what are your options? One, that you pick any 2, but you don't know which ones will go ahead. So your number of attempts before you reach a successful embryo transfer may land up being higher because all of them are not going to progress. The other alternative used to be to transfer too many, hoping that one will implant. What if all of them implant? That's why women used to end up with higher order multiple pregnancies, which now they don't, because we wait up to the blastocyst stage. We never transfer more than 2 embryos, and more we are moving towards precise embryo selection and a single embryo transfer, because a single pregnancy is safer.